Wow. They look great.
Oh, they look amazing.
Good. It is so different. It was amazing.
In November 2021, we did anterior lower extremity. At the time, we were putting patients to sleep. So we did her anterior thigh, knees, below the knees, all the way down to the ankles. And then in March 2022, we did her posterior thighs, posterior knees, ankles, all the way, calf, ankles, all the way down. We took 5 liters in each session. She still has more lipedema, and today we're doing her 3rd stage. But the difference is this time we're doing it awake. And I'm so excited to see the differences between being asleep and being awake, kind of from somebody who's done by us before, and we know patients have been doing so much better being awake. She's gonna tell us exactly how it's gonna be. Super excited for her. She still has some lipedema, mainly around the knee area, a little bit in the calf, kind of down to the ankle. So I'm gonna use a very small cannula on her, go in and really kind of push it. That's a limit though in terms of how much we can push, because the thinner we are, the more potential for contour irregularities. So that is this sweet spot where we want to push it as much as we can to maximize it, but not too much so that we don't get any contour irregularities. It's gonna look great. She's gonna do awesome.
All right, Donna. Now, if you want to stand on this little pad thing for me right there, we're going to start getting you prepped, okay? Awesome. Doing good so far?
We're doing great. We're doing super, super good.
So what is equalizing, Dr. Salameh?
Equalizing is meaning going with a special cannula, that basket cannula, and breaking all the residual fat cells, any scar tissue that she has. So you go in and break all the areas so that it's nice and smooth. Lipedema liposuction is very different than regular liposuction. The reason for that is the lipedema fat is a pathologic fat, and it's more granular, more prone to irregularities. That you gotta take more time, smaller cannulas, more involvement of the calves, ankles, knees, and lipedema. Sometimes it involves the upper extremity, arms and forearms. It's pretty much a very totally different procedure.
And lipedema only affects women?
Yes, mainly affects women. And the data out there says about 1 out of 11 women, they have lipedema. So
Is liposuction one of the only ways to treat lipedema?
yeah, liposuction is really the main treatment for lipedema. In a way, it's having the patient move their legs and help us with the process. It really gives us a better access. And the other good thing about the wake, if they feel like tightness in the shoulder or numbness, or that is kind of like sitting on a nerve, they're gonna feel it and they're gonna move.
How long have you known that you had lipedema?
I mean, I have felt different all my life.
Yeah.
I'm not sure what it was for a long time. And then I realized it could be brought on by stress. I feel much better when I do work out or walk.
Well, hopefully after today you'll be able to walk a whole lot. It won't hurt as bad.
I think I will.
I think so too. I think it'll be good for you. How's it going?
It's going. Her knee is shaping very well.
About how long, Dr. Salameh, does this procedure take?
About 3 to 4 hours over there. The reason for that is we do it 360 all the way around the knees, around the calves, ankles. We use multiple cannulas.
Is it about the same time for other liposuction, or is that just for the legs?
For the legs. The legs takes the longer. Thighs is faster usually. Because lipedema fats come back. And the answer is really no one knows. However, we do know you can minimize the chances of that lipedema fat coming back by maintaining healthy diet and exercise. Liposuction around the knees, calves, ankles.
Wonderful.
Yeah, we did awesome. We did more on the left side than the right side because we had more on that side. She did great. That was a tough case. Tertiary back after front, back, and then 360 awake. She did awesome.
Wow.
Very good. Yes, ma'am.
They look great. Oh, they look amazing.
Good. I'm good. I'm glad you're happy.
Thank
They
you.
really do. Yes, ma'am.
It is so different. It was amazing because I was able to put my compressions on. I was able to sit up. I went to the bathroom. I walked in there and my legs, like, they don't really hurt. The best part was because last time I was in a wheelchair. I had to be wheeled to the car. I was so dizzy and sick. I don't feel sick. It's like you had surgery and you get to go home and recover.
Yeah.
I'll go home and have tea and coffee with the girls. It's
mean, how cool
amazing
is
because
that?
I'm walking out. I actually got up and went to the bathroom. They really don't hurt.
It's crazy. It's life changing.
It is.
Like
I
just
mean,
you finish, you walk out.
and like you
After 4
know,
hours of surgery.
I'm gonna be 60 in November. I have to keep up with my dog, and I can't have pain. So thank you
We
so
got
much.
you. We got you, Donna. Anything you need, we're here for you.
You don't have to wheel me out.
Wow, you're walking out. No wheelchair?
No wheelchair, nothing.
All right.
Isn't that awesome?
Yeah, you're looking good. How you feeling?
I feel good. Actually, I feel great. My legs feel great. They look amazing.
Love it.
Alright, hey guys, we just finished another awesome day. We did a tertiary lipedema liposuction on our amazing patient. We previously done her asleep twice. We took 10 liters out, 5 liters for 2 separate times. And today we did the 360 knees, calves and ankles kind of to really finish her. And she did amazing. I was super impressed with her. She walked out after the case and I was like, oh my God, you look amazing. Last time after her general anesthesia, when she was like kind of in a wheelchair, kind of tired, and which is typical after general anesthesia. She did great, she could see the outcome immediately. It's really life-changing. That's why we love Awake the procedures, because patients are doing so much better. There's no physiologic changes, there's minimal blood loss, the procedure is cleaner, and their recovery is much faster. Thank you so much for following along with us today. Make sure to like, comment, and subscribe to our channel. And if you have any questions about what we do, make sure you leave them below, and we're happy to answer any questions you have.